So why do newborn babies cry? Let's understand your baby's signals. Imagine this. It's 2 a.m. and your baby suddenly starts crying. The cries pierce the silence of the night and the panic sets in. You start asking yourself, is something seriously wrong with my baby? Well, sometimes crying can be a sign of a bigger problem, but often it's just your baby trying to communicate. I'm Dr. Kunal Pai, and in this video, we're going to dive into the various reasons why your baby might cry, and more importantly, when you should worry. So the number one reason why babies cry is for basic needs, and that is hunger. First things first, let's address the most common reason why babies cry, and that is hunger. Babies have tiny stomachs, so they need to eat frequently. If it's been 2 to 3 hours since their last feed, it's a good chance that hunger is the culprit. The cry for hunger usually starts as a soft whimper, but becomes more intense if it's not addressed. Watch for cues like smacking lips, sucking on fingers, or rooting. Number 2 is wet diapers. Imagine sitting in a wet or a dirty diaper for hours. Discomfort from the wet or soiled diaper is another common reason for a newborn crying. Check their diaper often and change it promptly to keep them dry and comfortable. If crying stops soon after a diaper change, you know that was the issue. Number 3. Newborns are very sensitive to temperature. A baby who is too cold might cry to let you know that they need to be wrapped in a blanket. On the other hand, if they are too warm, overdressed, or swaddled too tightly, they'll also protest. You can check the baby's neck or chest to gauge if they feel too hot or too cold. Dress them in layers and adjust based on the room's temperature. Number 4. Colics due to gas are a notorious cause of babies crying. Newborns can swallow air during feeding, leading to gas buildup in their stomach. They might cry loudly or squirm or arch their backs. Gentle tummy massages, holding the baby upright during feeding, and burping them afterward can help alleviate some of this discomfort. If the crying seems excessive and happens at the same time each day, it could be a colic, a more severe form of digestive discomfort. Number 5. Babies love skin to skin contact. Sometimes they simply want the warmth and comfort of being held close to your body. It might sound like spoiling, but newborns need to feel safe and secure. If your baby cries and then quiets down when you hold them, they might just be looking for a cuddle. Now, all these reasons for crying are usually harmless and easy to resolve with a bit of love and care. However, sometimes crying can signal something more serious. So when do you worry? Here's when you need to consider calling your pediatrician. Number 1. If the cry sounds unusually high-pitched or shrill. Number 2. If your baby cannot be consoled despite all attempts. Number 3. If they are crying inconsolably and show other symptoms like fever, vomiting, or diarrhea. Number 4. If the crying is accompanied by sudden change in behavior like extreme lethargy or refusal to feed. If you notice any of these signs, it's best to consult your doctor immediately. So why do newborns cry? Most of the time, it's simply their way of communicating their needs. Hunger, discomfort, or a desire for warmth and closeness. Understanding these cues can help you respond better and soothe your baby quickly. But always keep an eye out for these warning signs that might indicate something more serious. Remember, you know your baby best. Don't hesitate to reach out to your doctor if you feel something's off. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe to our channel for more tips on caring for your little one. Hit that notification bell so that you can never miss an update. Thank you.